You're listening to a Raconteur Studios podcast.
Welcome back to the After Hours Skin Clinic. I'm Dr. Emma Craythorne.
And I'm Dr. Ellie Rashid. We're here after hours to get real about the skin questions that you're Googling at 11 p.m. but forget to ask your dermatologist.
And in this episode, we're talking about two incredibly common concerns that people have. One is going to be spider veins, so we'll break that down. And then the other is cellulite.
Yes, so those red, blue veins that creep up on our legs and that classic dimple texture that gets people panicking before the summer.
So we're going to break it down to why you get them. Is there actually anything at all that we can do to treat them? Or is it really just about learning to realise that they're part of you and you should just love them?
Love them.
Love them. Episode finished. Should we start off with spider veins?
Yeah, so I guess the reason why people develop spider veins is usually there's a genetic predisposition and then other factors can contribute to it. So if you have a job where you're sort of standing for long periods of time, if you're pregnant, depending on how old you are, and really it comes down to the blood that flows back to our heart through our veins, these little valves that are there to keep the blood flowing upwards. And as we get older and due to genetic reasons, they just become less competent and less good at functioning as a valve to stop the blood flowing backwards. So what happens is that you get this blood that sort of pools and these little vessels that dilate on the surface of our skin. And that's the appearance that people then notice that they don't like the appearance of.
And quite often these will happen as well after changes in lifestyle. So if somebody's become pregnant, for example, then two things happen here really. First of all, you're making more blood anyway, so there's a lot more of it to be pushed around. But also you have another human almost compressing the backflow of the blood back to the heart. So more likely to build up the blood within the veins of the legs. And that's why people who are pregnant will often get a lot of swelling of the legs, but also the veins are under much more pressure. And then when that human has left the building and you're then able to get the backflow sorted out a bit, unfortunately, many of the veins that occurred because of that, they're there and they're visible. So I think that sometimes after pregnancy is when people start to realise, oh, I didn't have these before and they're there now. Did that happen to you in any of your pregnancies?
My shoe size went up by a whole 1 during pregnancy. Honestly, didn't go down for ages, but now obviously I can fit back into the shoes, but it really took a long time.
So that's a good example of, what happens to the actual fluid and the tissue whenever you are pregnant. So the same thing can happen with these little spider veins. And also if somebody has had a lot of extra weight, so if somebody has been very obese, for example, and then they lose weight, all of those veins are still there. So then you end up seeing these little spider veins as well. And I suppose there's different kinds of veins. When we think about spider veins, I typically think of the purpley coloured ones that are very, very thin, and often they look like almost like a starburst where they kind of flare up. And then you get the larger veins, which are typically feeding these starburst purple veins, and they're often blue and a bit more obvious. And then moving on up, you then have varicose veins, and these are veins that are much bigger and they're really not competent in a way that a vein should be. They're not very efficient at getting the blood back to the heart, is the job that they have to do. And quite a lot of those varicose veins tend to run in families, don't they? It's just a genetic way in which your collagen is made and the way ultimately you end up making these veins.
Yeah, and there are environmental factors that can influence the development of your spider veins as well. So if you imagine your skin, so with lots of UV exposure, you get some degradation of your collagen, and that can also have an impact on the appearance and the presence of the spider vessels. So you can sometimes notice them on people's chest and décolletage area where they've got lots of these little spider vessels and these little dilated tortuous vessels on the surface of their skin.
And spider vessels or spider veins are actually really common in the context of somebody who might have a condition called portal hypertension whenever there's liver disease. So you might end up with lots of these red, blotchy little vessels appearing on the chest and on the face. But just having, lots of them doesn't mean that you have liver disease, but we do see it in people who have liver disease. And then the other thing that you can get are these tiny little things called spider nevi, which are a tiny little kind of central red body and it looks like little legs coming off it, which is why they're called spider nevi, because they look like tiny little spiders. And they're very common to get, particularly on children and on children's faces. I have a theory about this. Do you know what my
Tell
theory
me,
is?
what is that?
It's so good, I think. My N equals
the
1
best.
study. It's the best study. Because like, why do children get spider nevi? Why do they get them? Do you know?
I don't know, but it is definitely more common in children.
Yeah, and nobody really knows why. And so I have a picture of Rory when we were on holiday with a mosquito bite on his cheek. And it was a decent size of a mosquito bite. And then the mosquito bite went away. But about 3 months later, at exactly the same point, and I compared it to pictures, is where he now has a spider nevi at exactly that point. So I do wonder, is there something about a little tiny injury to the skin, whether this is a bite of a mosquito or a proboscis injury or something like that? Is that little micro injury the thing that's then set off the blood vessels in that area? So a tiny micro trauma, I think, must be responsible for these little spider nevi.
Might well be.
I think it is.
I tend
It
to
makes
notice
sense.
quite a few spider nevi in children's noses.
Yeah.
And it's, I guess, it's getting scratched, traumatized.
Yeah, I think that is my theory.
Right, fact.
Okay, we both agree.
Great. Well, that is now fact.
So if anyone has a child and they'd like to join our study of why you have spider nevi, let us know. Anyway, they're the different types of kind of vein issues that we see. But going back to the true spider veins and not spider nevi, should we think about where people should be spending their money to try and get rid of them? So to be quite clear, the spider veins are the broken blood vessels that are typically on the lower legs, sometimes the upper legs, buttocks. What are the things that we can be doing to reduce those? And number one is not buying a cream.
Yeah. Don't buy cream. So it's not something that I do, but sclerotherapy, where you inject this occlusive agent into those dilated vessels to then basically block them off. And then so it goes like a white colour and then it just disappears. So sclerotherapy, it's something that I've noticed patients having done with good effect.
Yeah, so you inject it directly into the little vein, and just by directing it in, you don't have to do lots of injections all over the place. You can just do it into one. And if it's, the one feeder vessel in one little shot of the sclerosing agent, it seals up all of the kind of tributaries to that area you've injected it. So it's really quite efficient. So that's just normal sclerotherapy. And then you can do something called foam sclerotherapy. Have you ever seen that made up? It's essentially where you are creating a foam from the sclerosing agent. So you squish it back and forth in the syringes and make it all bubbly. And then you're injecting that bubbling sclerosing agent in. And that can be, effective if it's slightly bigger vessels. Yeah, so that is one thing that can be done easily in clinic. So I think if it's those very superficial little flare spider nevi, injecting with a sclerosing agent, so sclerotherapy, is really effective. Or using some of the neodymium YAG or the pulse dye laser can be effective for some of them. I would say that's fine. But you have to remember, these are typically being created because they're under pressure from other veins. So they'll come back. And, you want to really get in and treat the other veins that are that problem.
A very unsexy product that you would use to try and improve the blood flow back to the heart are compression stockings.
I love compression stockings.
So do I, but they are so annoying to wear.
But you can get all kind of fancy ones now. You can get ones that are like multicolored. You can get ones that are like quite, funky. You can get ones that are really comfortable. I love a compression stocking.
Oh my gosh. Like even getting on a flight, I think about wearing compression stockings and I just can't bring myself to do it. And after having babies, then equally, you have to put your compression stockings on, but they're just so blooming uncomfortable.
Yeah, I don't mind. I think if you get ones that are made of nice material and they are quite glidey almost to put on, they're fine. If I was in a long operating list on a Mo's day, for example, where I know I just will not sit down all day and some of the operations are a bit longer, I will wear them that day.
Don't you get hot?
No, because they're kind of, if they're the right material, they don't feel hot at all. You need to try. I'm going to get you a pair. Honestly.
Could wear them.
I'm going to stop you ever having fat ankles.
Fankles.
I think so. If we go through the best treatments, we'll say creams, number one. Just don't even waste your money. There is just no point.
Yeah. Cream's not going to do anything.
Zero. Actually, I'll caveat that with no cream to treat it. But if you wanted to cover it, there's very good camouflage makeups that you can put on, and then you kind of fix that makeup with a talc, like a setting powder. And that can be really effective for people who, are maybe not wanting to intervene and do anything, but want to wear a nice skirt for the day, but they feel a bit embarrassed about if they've got lots of veins there. Or you could just...
Yeah, the only issue with the camouflage is, particularly in the summer, it just sort of rubs off on stuff.
Not if you put the setting powder on, it can be quite good.
Oh, really?
Yeah,
So it wouldn't rub off on, like, if you're wearing a white linen skirt?
No, it stays on really quite well, and even on the beach and things like that. It's not that it's a waterproof camouflage, but it's pretty good. Okay, we're trying to think of other ways around it, but basically either have sclerotherapy or
some laser treatment.
Laser. I always use the Vein Clinic on Harley Street.
Yes, yeah.
That's my number one go-to. Okay, so now we're going to move on to cellulite. So let's start with why we have it and why we see it more commonly in women rather than men, and that anatomical difference between women and men. When we think about how our subcutaneous tissue is made, so that's the area where we have fat. You've got your muscle at the base, and then you have what's called the deep fascia, which is like a lining over the top of the muscle. And then in between that deep fascia and your skin that you have on the surface, you typically have a layer of fat. We call that the subcutaneous fat. And within the subcutaneous fat, exactly perpendicular to it, you have these septi. And the septi go from the deep fascia all the way up to the skin, and they almost act like little fences holding all of the subcutaneous tissue in order. Or otherwise what would happen is you would stand up and all your subcutaneous fat would just kind of flollop to the bottom of the floor. So these act as little kind of fences to hold the fat in place. And women's subcutaneous septi are typically actually a little bit stronger, the pull that they have on the surface of the skin. And if you imagine something almost like an anchor down to the deep fascia, pulling it down, it can look like a little dimple. And that's really what the cellulite is. Now, the more you have subcutaneous fat, in other words, the more you've laid down fat in the skin, then almost the greater the bulge out will be, because you still have the same septi pulling the skin in. So you've got the bulge coming out, which is subcutaneous fat, and then the septi pulling it in. And that's what creates this dimpling effect. And because women septi are usually a bit stronger, so the pulling down part, and because they typically have more fat in areas like the hips, the buttocks, the back of the thighs, then that's why typically these are the areas that we see cellulite. So you'll even look at a tiny little baby of, maybe running around at 2 years old, and you can often see cellulite on the buttocks and the back of the legs because of this subcutaneous fat and because of the septi.
I always think of it as like this mesh that keeps all the subcutaneous fat in place. And then you've got these little pouching out of the fat through this mesh. And the more fat that there is, sometimes the more these little out pouchings of fat through this mesh. That's how I always think of cellulite.
Yeah, it's like that, isn't it? There's just more pressure underneath, so it's getting pushed up. But it's fair to say that sometimes some people have more of a problem with this than others, depending on how you make your actual overlying part of your skin. So you know how some people, they seem to have skin that their collagen is ever so slightly different, and so their skin is, let's use a very rudimentary thought, that their skin is thinner. Then if your skin is going to be thinner and you've got more of that pressure, those bulges are going to be a bit more obvious. And I suppose at certain times of hormonal fluctuations where you might have more kind of fluid on board, then that's going to provide even more pressure as well. So I would say in those situations, so genetically, you're more likely to have it if your mother, father, whatever, had worse cellulite, then you're going to inherit that tendency as well.
I always think people have worse cellulite. It's probably genetically determined, but it's sort of like the structure of that mesh and the shape of those fibrous bands and how they're keeping the subcutaneous fat in place. Imagine like a lacy mesh over the top of the fat. So depending on the pattern and the size of those fibrous bands and that mesh, then people would have more cellulite or less cellulite. And then if you've got more fat build up, or the size of your fat globules as well that can sort of push through that mesh and then create that dimpling effect of what we see as cellulite.
People are often bothered by their cellulite. It's not something that's typically lauded as a feature that people want to have. And I think many generations ahead of us didn't like cellulite and it became stigmatized in a certain way, whenever in fact it's just our body's fat.
I mean, yeah, like most people will have cellulite. Like pretty much everyone will have a degree of cellulite. Some will have more, some will have less. But I think also, like, we grew up with magazines where you'd have like this big circle and like, look, famous person has cellulite. Yeah, and what?
I have cellulite too.
Yeah.
I have cellulite too. I have cellulite too.
And I think we're so much more thinking about body positivity and like this is normal, and I just think we need to embrace it and love it. I'm actually not that bothered about my cellulite. It's there. I know it's there. I know that if I wear something short that it will be obvious. I know that when I wear a swimming costume or a bikini, people can see it. It doesn't bother me. It's just the way I am.
But it's the way everyone is.
Yeah.
That's why I find it so kind of crazy that it has become this stigmatized way because of magazines, particularly I suppose in the 90s and noughties, where, like you say, this highlighted area on somebody's thigh to show they had cellulite. And, you go to the beach and you can just look at the vast majority of little toddlers running around or, teenagers about to enter into puberty. They all have cellulite. So,
Do you think it's something to do with us seeing so many different bodies every single day at work? Like, we know it's so normal. Every single person has it.
I mean, the allure of a magazine and this image of perfection that you see in magazines or in social media or whatever it happens to be, where there are filters applied, there are photoshops applied, especially us as dermatologists looking at all these bodies all day long, we know that that just doesn't exist. I mean, I look at so many naked bodies all day long. It just does not exist like this. So I think that we can kind of roll our eyes and go, oh, ridiculous.
And we also can look at a magazine and know that that's not real.
Yeah. But it must be really difficult if you don't have the eyes that we have and you believe that this is a real thing and that, real women don't have cellulite. I mean, not true.
Or that it's achievable in some way.
or
Like,
it's
if only
achievable.
I exercise more, or only if I could lose weight, or that, then I wouldn't have cellulite. But actually, doesn't really matter. So very thin people with a low BMI, low body mass index will have cellulite.
Despite all of that, it is a huge market where people will be spending lots of money to try and achieve this no cellulite look. And some of the things that are marketed are just absolute nonsense. So shall we go through some of the things that are available? And if somebody is particularly bothered or wants to try these things, whether it's worth their while or not.
Yeah, so I guess one of the products that I think might have some benefit, but not the benefit in the way that it's marketed to have a benefit, are body creams that have retinol in them, so this vitamin A derivative. And I guess the way that would work to help improve the appearance of someone's skin is that it increases your skin cell turnover and can, over a very, very long period of time, some of these vitamin A derivatives, tretinoin being the most effective at doing this, can help build up collagen. And so I guess the appearance might look smoother when you're looking at an area that's got cellulite. But it's not really doing anything because it's not ever going to, anything that you buy over the counter is never, ever, ever going to penetrate deep enough to have an effect on those bands, those fibrous bands and those septi that are holding that subcutaneous fat in place.
I agree, but I do actually almost disagree with the idea that you should even waste your time putting retinol and even tretinoin to a certain degree under the skin. I just think it's going to take so long to see any kind of effect that it will be incredibly costly. And it would take years and years and years to see an effect, I think, on the areas that you want to. Plus, now with the new EU regulations about how much retinol you're allowed to even have in a product. So yes, I agree. If you're putting on very, very strong vitamin A and you're putting on a lot of it every single day, you're going to run into irritation. It's going to be annoying on those body areas. It's going to give you a bit of a dermatitis to begin with. But actually, with these new EU laws, you're not even allowed to have that quantity percentage in the cream anyway. I think just, a very good moisturizer in itself is going to condition the skin and make the skin feel kind of more supple and reflect light in a different way. And so I think that in truth, the topical idea that I'd like to think that you might get from retinol. I just think it would just take so long that it's not even worth it. You would get a temporary effect from caffeine. So there is that, isn't there?
Yeah.
So I'm just thinking we could have a moisturizer that has some caffeine in it. That gives a temporary kind of like tightening effect to the skin. But it is only temporary. It's not like a permanent thing. But maybe it's not the creams itself. Maybe if we think about actually how the creams are applied and the massage technique, that's going to be helpful, right?
Yeah, so there was this body cream that I was using that was like an anti-cellulite body cream. But actually, what was interesting about it is the way...
Why were you using it? You love your cellulite.
I just got it for free. And I thought, why not? Let's just try.
I need a good moisturizer. I've ran out of body moisturizer and this will do.
The way that the tube was it had these little massagey roller beads at the end of it. So you'd like squeeze the product and then the cream would come out onto these little like massaging roller beads, and then you would like roll it onto your skin. And so I think the massage is probably the thing that's making the difference, because if you think about lymphatic drainage massage, that reduces some of the swelling, improves your lymphatic flow. And so reducing the amount of swelling in that area could have a benefit for the appearance of cellulite. So the cream itself probably wasn't doing very much, but it was just the way that it was packaged and the way that you would use it that was probably having a benefit.
Yeah, I think that's right, because even when you think about massage and just getting more blood to the area and the support then it has to the skin, I think that's,
Spend your money there.
Yeah. Give me a massage, please.
Oh my God, love a lymphatic drainage massage.
And then there are a few other things. So there's things like injections that can be done. So there was an injection that came out a few years ago that was a collagenase injection. It had an FDA license showing it was safe to use. And that's essentially where you have lots of these micro injections are put into the skin. It was done for the thighs and the buttocks. And the collagenase essentially broke down those hard septae that were holding the fat in place. So you didn't have that pull down, that real kind of the anchor part that's causing the depression. And it broke those down. And that was thought to be quite effective in the areas where it was injected. But the problem with it was, as it turns out 2 years later, that there were so many complaints because of the bruising and the skin colour changes that went alongside the bruising that it then got withdrew from the market. So there was 2 years where there were injections for cellulite that, of course, as always happens, everyone jumped on board and did. But actually, because often the first release of one of these kind of treatments is almost the clinical trial. Always. And then it was stopped. So that is a no-no.
And then how about those cryotherapy things? So a friend of mine had that done to try and improve her cellulite. Didn't work.
Yeah, so that is the idea of cryolipolysis. So if you freeze fat, then essentially it dissolves. So if you get fat to a certain temperature, it makes the fat smaller and dissolves away. So you have it wrapped around you, the area is frozen, the skin on the surface is protected by some heat, and it's just the target is obviously just the fat. And then this is the idea that you're shrinking the fat down. So if you shrink down the subcutaneous fat, then you reduce the amount of dimpling that occurs. So you do get loss of fat in this technique for sure, but there are side effects. In a very small number of people, you can actually get the exact opposite happening, and you can get hypertrophy of the fat, which means you've got more fat in that area. So you've achieved exactly the opposite effect of what you want. And that, if you remember, is what happened to Linda Evangelista after she had this cool sculpt, and she ended up getting more fat in the area she was trying to get rid of it. So that is obviously not desirable. Although even if I look like Linda Evangelista after the problem, it's fine. She's still gorgeous.
Stunning.
Yeah.
I got a story about a patient that had mole mapping done. So this is where you go into this machine, you have all your moles mapped out, and then usually a year later you come back to have your mole mapping done, and then the AI technology checks to see whether any new moles have arisen or sort of whether there are any changes within the moles that you've got. Anyway, this patient came for their mole mapping a year later and had this cryo cool sculpting treatment. And then the machine had picked up all of these like little vessels, new arising vessels. And the machine said, there were like hundreds of new moles. So what the hell's going on? So looking at the skin, thinking, what on earth has happened? And he developed all these like broken blood vessels across all of the treated areas. And I'm not sure if they settled down. Like that was a side effect that it had as a result of this cool sculpting treatment. Like all these little broken
And he'd
blood
lost
vessels.
quite a lot of fat as a consequence of that?
No, it didn't do anything.
Oh. Other things that people do for cellulite is obviously liposuction, which I think will obviously reliably remove subcutaneous fat and therefore reduce cellulite.
I don't know that many people that have had liposuction, but those that I do know that have had liposuction have ended up putting all the weight back on and then sort of going back to baseline, if not worse than baseline.
Our fat is incredibly clever at being able to just defend itself. And, it's this amazing kind of tissue that is like, oh my gosh, someone has removed us, replicate immediately so that we can replace our lost soldiers. And unless you're hugely calorie restricting, that will just come back. I suppose there are some other treatments as well that we think about that people do. So there's different ways of targeting it, isn't there? Number one, you're either going to make the skin envelope stronger. And so that's with this idea that you can put a cream on to make your skin envelope stronger. You can't. But things like microneedling radiofrequency, known as the Genius RF or the Morpheus, and these devices are thought to tighten the skin and make the skin stronger. And this idea, if you make the outer envelope of the skin stronger, then it's going to hold the fat back, so you're not getting dimpling in the same way. You would need to have lots and lots and lots and lots and lots of those treatments, I think, to have that meaningful effect. So it's not an effect that I'm going to jump on and say that would be a treatment for it. You'd be spending
it's expensive.
So expensive. Can you imagine how much money you'd have to spend?
Yeah.
And it still probably wouldn't work.
Yeah.
And then we think of the next layer down, which is attacking these septal bands that are holding the skin down and then allowing the other fat to kind of pop through. And that's where those collagenase enzymes came in, where they tried to break it up. That's not available. And then sometimes some people do something called subcision, where they go in with a long silver pole with a sharp end to it, like a big needle. And that can be inserted under the surface of the skin. And then it just quite aggressively breaks up all of these septal bands so that you don't have that anchoring of the skin down in quite the same way. It's called Taylor Liberator subcision. It's a very long needle that does that. And then you can have the liposuction as well, which is usually everything's broken up, but then the fat is also sucked out at the same time. So I suppose that is the way in which people target cellulite. Obviously, if you're somebody who is overweight and your BMI is high, just by reducing the subcutaneous fat in that area by dietary means will reduce the cellulite. I mean, it just will. It won't get rid of it because the septal bands are part of the problem. But if you don't have that same bulk pushing through, you'll definitely get an improvement. But just if you're somebody who's already got a normal BMI or a low BMI, then that's not the answer. So if we break down these two common things that people think about, let's do spider veins first of all. Incredibly common. Most people will have some of them and some people have a lot of them. But in terms of treatment, what is your go-to?
So go-to treatments would be sclerotherapy and laser treatment.
And if it's an underlying bigger problem that's continually driving these, then
see a vascular surgeon.
Yeah. The vein clinic. That's like my go-to. Everyone, the vein clinic. And if we're thinking about cellulite, this is something that almost everybody has. It's ubiquitous in society, all ages, both sexes, but women typically more than men just because the way they are anatomically. Most creams we think are pretty rubbish.
Yes.
But the massage of the cream.
Massage, I think can have a benefit. And then caffeine, temporary benefit. But really, we don't think that people should be spending lots of money on lots of expensive treatments and just learn to love and embrace their cellulite.
Yeah, I totally agree. I love the fact that you're just trialing out your cellulite creams when you get them as a nice moisturiser.
Because you know what it is? Because it's got the little
nice moisturisers.
And also the massaging.
Yeah.
It's like I feel like I've had a bit of me time. A little bit of like luxury, enjoying a little process.
So thank you for joining us on another After Hours session. If you've got questions or want to hear us cover something specific, then send us a DM on Instagram, via email, or drop a comment. Details are all in the show notes.
And don't forget to follow and subscribe.
And take care of yourself and your skin, and wear your SPF,
which is never, ever not relevant.
And see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.